I just got to quickly go to Debbie's to finish this up. I've got a clamp holding what I've just.
I mean,
Okay, I think it's slowing down a little, so we might get started in the interest of keeping to time, I think. Daryl, are you okay with us?
Yes, that's great. Thanks, Jodie.
Okay, great. I'll get started then. Welcome, everyone. I'll start with an acknowledgement. Daura nona wo. Yangu golanyan nalawiri dunayan nona wo daura. Wonga religionen, marin, balan, bugraban. I've started with an acknowledgement in the language of the Ngunnawal people, the traditional custodians of the land on which I'm speaking to you from today. It means this is Ngunnawal country. Today, we're meeting together on this Ngunnawal country. We acknowledge and pay our respects to the elders. I also acknowledge the lands from which each of you are joining us today, particularly those who may not be on Ngunnawal land. And I pay my respects to all Aboriginal or Torres Strait Islander people, and particularly those online with us, and give recognition to the centrality of your culture in providing strength and meaning to the lives of your children and young people. Hello, everyone, and I think we will continue to see more everyone's joining us as we get into the first couple of minutes. But for those who don't know me already, I'm Jodie Griffiths-Cook, and I'm the ACT Public Advocate and the Children and Young People Commissioner here. Thanks for joining us. Together with Professor Daryl Higgins from the Institute of Child Protection Studies at the Australian Catholic University, I'd like to welcome you all today to a discussion about reimagining child safety in the ACT. We thank you, and I particularly thank the increasing numbers of people coming on for your interest in this webinar, which aims to raise awareness on what is needed to strengthen and further embed public health approaches to child safety. Including discussions about what's currently being done and in particular my interest in discussing where we can go to from here. We've allocated time at the end of the webinar for questions. However, as we're speaking, if there's anything you'd like to make a comment about or if there's a question to raise, please use the chat panel and you can bring that up. There's a little, for those who aren't familiar with Teams, there's a small box, little square sort of speech pop-out box with a couple of lines on it. If you click on that, you should be able to bring up the meeting chat screen and be able to type messages. We'll use that chat panel to address questions and comments later on in the discussion after we've done a bit of upfront presentation. If any questions or comments pop up, I guess, that align with something that you want to say, rather than restating that comment, feel free to hover over that message and you'll get a little panel pop up and you can like that, and that'll help us keep track of if there's any particular key issues that are of value to us. And I'm really conscious my eyes flipping back and forth as I'm watching all the people joining here. It's great to see the numbers. Please also be aware that the webinar will be recorded, so do keep that in mind. And finally, to assist with the Teams connection, we have got everyone's microphones on mute and videos off. If we can maintain that, and I'm pretty sure that Maria may actually have the control over that, but if we can maintain that, that would be great. It just helps us maintain the stability of the platform as we move forward. So the plan for the next hour and a bit, I'm going to begin by providing a bit of context, I guess, for my interest in pursuing public health approaches to child safety from and within the ACT perspective. Daryl's then going to talk us through the value of public health approaches and in particular how this can enhance our approach to child safety. I'll then briefly, I guess, provide some examples of public health approaches that I'm involved in, and including a linkage to the forthcoming regulation of child safe standards here in the ACT. And after that, we'll open up for a bit of a discussion and consideration of what might be our next steps, including how those of you who are joining us here today might be interested in working with us to move this forward. We'll use, as I've said earlier, that chat panel to keep track of comments and thoughts that people have and try to respond to those through that sort of latter end of the discussion. However, if there are any questions that we can't get to today, Daryl and I will discuss after the webinar how best we can perhaps address those after the forum. So, why am I advocating for this reform? As many of you would know, and as I mentioned earlier, I hold the dual roles here in the ACT of both Children and Young People Commissioner and Public Advocate. As Children and Young People Commissioner, my focus is really on ensuring, I guess, that relevant stakeholders listen to and seriously consider the views of children and young people themselves, particularly in the development of policy and of service responses. I guess from my perspective, in designing and delivering ways to empower children and young people, it's really important to make sure that they have a say, that they have the opportunity to express their views about issues and any other matters that concern their lives, but more importantly, that we actually use that in a deliberate and considered way to make changes as we're moving forward. As Public Advocate, the other hat that I wear, my office monitors and oversights child protection services, including youth justice here in the ACT. In doing so, we've got a really keen focus on ensuring that systems operate in a way that's both consistent with legislation and equally that uphold the rights of children and young people. There's a number of different legislative instruments that, and I've lost count of how many, that actually give us responsibilities, or give myself and my office responsibilities that support, I guess, the monitoring of services for the protection of children and young people. Obviously, as a human rights jurisdiction, the Human Rights Act in and of itself underpins all that we do. And then behind that, I guess, sits the Human Rights Commission Act, which outlines more specifically some of the legislative functions for my roles within the context of our operations as part of the ACT Human Rights Commission. However, as I mentioned, there are numerous other legislative instruments that assign responsibilities to me as either or both Public Advocate and Children and Young People Commissioner. Notably, I guess, those other legislative instruments and the rationale, I guess, behind the responsibilities accorded to me through those legislative instruments is that by design, there are certain systems that, I guess, limit the rights of those who come into contact with those systems in the interests of addressing concerns that require some form of statutory intervention. For example, and relevant to today's discussion, child protection systems, by extension, have the capacity to limit the right to family by virtue, obviously, of responding to child protection concerns for children and young people. It's these systems, I guess, where those limitation of rights occur that I'm charged with responsibility for oversighting. As part of that, for instance, the Children and Young People Act here in the ACT requires certain documentation and information to be provided to me, to my office, to enable us to monitor practices that may limit the rights of children and young people and of their families. For example, and I've seen a number of people online who are from that very child protection system, but we receive advice when the Director General takes emergency action and removes a child or young person from their family's care. We're also notified about any abuses, or not any, about abuses and appraisals of abuses that occur in out-of-home care. And we can make statutory requests for information, assistance, services, documents, and a range of other things in relation to the physical and emotional welfare of children and young people. There's also a realm of other different documentation that exists both within but also outside the Children and Young People Act that I guess gives us line of sight to issues impacting the safety of children and young people, and that includes information within the Personal Violence Act and Family Violence Acts. To give an example of what this means in practice, in the last financial year, so 2019-20, almost lose track of time, 924 children and young people were brought to my attention as Public Advocate. The vast majority of those come to us through those compliance documents that I've spoken about. This includes the over 800 children and young people who are currently in care here in the ACT, but also includes others whose families, carers, other concerned stakeholders get in contact with me in my office. In addition to reviewing that compliance documentation, we also provide different types and levels of advocacy. And last reporting period, we provided 2,409 occasions of advocacy, including 350 occasions of direct advocacy for 155 children and young people. For the most part, the children and young people brought to our attention are already involved in tertiary and service provision. So whether that's statutory child protection, youth justice, mental health or disability service systems, the vast majority are involved in some way, shape or form already with tertiary intervention. At its essence, statutory public advocacy is about making sure that systems do what they're supposed to do in the way they're supposed to be doing it. I use this, I guess, colloquial reference to the way that we operate and the responsibility, I guess, that's accorded to my role quite regularly. And I also add that ideally those services and systems are operating in a timely and responsive manner. You know, obviously, when we're talking about the limitation of rights of children, young people, families, you know, we want to make sure that we're operating in a way that gives answers, I guess, and direction and an understanding of where to from here as quickly as possible. Given that some of the legislation through which I'm assigned responsibilities effectively provides an authorising environment for systems that, as I said previously, by design limit the rights of those who come into contact with them, our focus is very much on ensuring that any restriction of rights is proportionate and the least restrictive option in the circumstances. We tend to apply a systemic lens to pretty much everything that we do, regardless of whether that be through individual advocacy, where we look for systems issues that might be occurring and we may tackle them at an individual level, or where we might, I guess, take a deeper dive into key issues through doing systemic reviews, developing submissions, or undertaking inspections and visits. For example, we have the opportunity and do regularly visit all of the residential care facilities or houses, sorry, here in the ACT. When considering the safety and wellbeing of children and young people, the question we tend to ask is whether as a jurisdiction we could do things differently. Can we do things differently to further prevent children and young people and their families becoming involved in child protection systems? What changes, what system changes, what reforms would make a difference, and have we got the capacity to be more proactive in the way that we're responding? You know, for me, I guess, you know, and I think given some of the names I do see on the line here today, improving outcomes for children and young people is just such a key priority. And I guess that's part of why I'm reflecting and believe, I guess, that a public health approach to child safety is a really important thing to progress and keep moving forward here in the ACT. I'm interested, and feel free as we go along, as I said, to pop things up in the chat panel. But when you think about child safety in the ACT, you know, what comes to mind? You know, do you think about ways to prevent child abuse? You know, perhaps you reflect on the statutory child protection system, for example, mandatory reporting. Do you reflect on, you know, the follow-up investigations, or do you think about supporting children who are already in out-of-home care? In the aftermath of the Royal Commission, you know, you might reflect on safety from the perspective of what's needed to be a child-safe organisation. Others might think about the challenges that exist in protecting and safeguarding children and young people, and some of the things like, you know, overrepresentation of Aboriginal and Torres Strait Islander children and young people, which we know in all jurisdictions, including our relatively small one, is very much still present in both the child protection and youth justice systems. Do you think about, I guess, the emerging concerns, particularly now, for the welfare of children and young people post-COVID-19? I know that's certainly something that's very much in my mind, and knowing we have some Victorian colleagues on the line who are still very much in the depth of the lockdown process, you know, the impact of that on kids and as they ideally and hopefully start to move back to, you know, the social interactions. But what are some of those long-term impacts that might come about? Do you think about the increasing demands for service? Do you think about the lack of resources, the gaps in service? You know, do you reflect on the personal toll, the impact of working in this field? For me, I think, you know, what drives me and what I regularly reflect on, given the nature of my role and the intel that I've got available to me, particularly as Children and Young People Commissioner, are the particular stories that I hear and the comments that are brought to me by children and young people themselves. Notably, and those who are local, and hopefully many of you who aren't will already be aware that recently my office was involved in a joint consultation project with the Family Safety Hub. in which we spoke to 70 young Canberrans, 35 of whom had lived with direct experience, I guess, of family violence. But we spoke to all of them about domestic and family violence and invited them, I guess, to tell us about their experiences with the service system, what helped, what didn't, what they think needs to change. And that was equally informed by those who lived with family violence, but also those who perhaps hadn't yet had an experience and hopefully won't, but who, you know, were peripherally aware and who still, you know, I guess, understood the nuances and the issues that are involved in those situations. Some of the comments we heard directly from children and young people, and I'll read these, that I think really get to the heart of why we're having this conversation today. But, you know, a comment like, we're talking about the kid needing support, but obviously the parents need supports too. Even if they abuse their kids, no matter how they do it, it's obviously because of something going on in their life. So they need support to get through whatever is going on in their life to try and be a healthier parent, whether or not kids are living with them. We heard comments with kids saying there was no support for me and no one listens. We also heard clearly we need a voice. I feel like a lot of kids feel like we don't have a voice. We go to someone, we do talk to them, but they're not going to listen. It's going to be like nothing. You know, I think putting these messages front and centre tells us that the ACT still needs to be safer for children and young people, and to find ways, I guess, where they and their families can get the support that they need, when and where they need it. The messages from the young people that spoke to us were clear. However, even more clear was the challenge that I think they set for all of us. Make sure our stories lead to real change. What we consistently hear from children and young people challenges us to reconsider our approaches to child safety, what we do and how we do it. If we're serious about upholding the rights of children for protection and participation, and if we're serious about adequately meeting their needs, then we need to listen to and act on what they tell us. In addition to analysing what we hear directly from children and young people, we also, through our role, I guess, review trends that we see through our oversight and monitoring functions. And notably in recent years, we've seen an increasing number of matters being brought to our attention, but even more so an increasing complexity of those matters. And often the key issue that we see in that or underpinning those matters is the need for an integrated and coordinated response, usually requiring multiple agencies. And that is often the thing that's missing, or the gap that's occurring for those situations. In the course of us looking at, you know, how we might achieve change in those spaces, we're very much, you know, we look at do our own research, look into the literature. I have discussions with my interstate colleagues, think about and talk about what's happening in other jurisdictions, and really look at ways that we can enhance and improve approaches to child safety and protection. The public health approach that we're here to talk about today is such an initiative. So I'm seeing all the comments popping up and just trying not to be just too distracted. I need to probably turn them off. So I guess, what is a public health approach to child safety? And I'm only going to talk very briefly to this before I hand over to Daryl, but effectively a public health approach is about intervening early to ideally prevent child maltreatment. It's about protecting children from harm through universal approaches or whole of population level responses, with the goal of getting to the heart of the issue, I guess, and mitigating, I guess, against crisis situations occurring. Public health approaches capitalise on services already involved with children and young people, where that trust, that rapport is already established, and where the families ideally are already engaged in service delivery. So adopting a public health approach, you know, requires, I guess, the development, a strengthening of the service continuum. You know, we need to look strongly, obviously, at those primary prevention strategies, but also look at, as we move along that continuum, what else is needed, what additional assistance, you know, in the form of secondary or tertiary responses are required for those children or families, particularly where a more nuanced or targeted, where more nuanced or targeted supports might be needed. And that means that supports can be provided at multiple levels, which is really important. But bringing all that together can be quite complex, and it really does require commitment from multiple people. It's, you know, it's a commitment from all levels of government, from service providers, from the community more broadly. and in particular, a real focus on, you know, the policy reform and then the practice changes that need to roll out from that. And I guess to give us more of that detail, I'll hand over to Daryl, who I know lives, walks and breathes this stuff every day. So Daryl, hand over to you and let you talk us through a bit more, I guess, about what public health approaches involve.
Thanks, Jodie, and look, it's a real delight to be with you all today, and thank you to you and your office for inviting us to be part of this webinar. Hopefully people can see the slides that I am flicking through. I'm going to go very quickly with some of them because they're really here just as background information. I want to kind of get to the kind of implications and discussion points, and for us to pursue the conversation, Jodie, at the end that we're wanting to have. But the slides will be available, so don't feel as though you have to write down everything. Here's a little bit of an overview of some of the things I'm going to be talking about in my section today. But before I do, I just want to add to that beautiful acknowledgement that Jodie provided and acknowledge the Wurundjeri people of the Kulin Nation down here in Melbourne, where I am, and pay my respects to elders past and present. And there's a couple of the references that I'm going to be drawing on in particular that outline really the research basis, if you like, for what I'm talking about. So in terms of defining what a public health approach is, interestingly, of course, we hear these words about public health messaging a lot these days due to COVID-19. And so I think that there's a broad kind of general community understanding of what that means, but I think it actually covers up a lot of misunderstandings, particularly within those, even within the professional sectors who are involved with child protection services. So I want to just make sure that we're all on the same page. So a public health approach to child safety and wellbeing, in order to try and prevent child abuse and neglect, needs to be predicated on, first of all, a good understanding of what it is that the risk factors are for child abuse and neglect, and then implementing strategies across the entire community. So you'll hear me talk again and again today about whole of population approaches in order to try and address that. So while we want to have the capacity to ramp up and have more intense services where needed, where particular risk factors have got out of hand, the aim is really to have the bulk of our efforts trying to alter the risk profile of the entire population, so to kind of reduce that burden of disease right across the community. So that means, therefore, to actually prevent maltreatment, we actually have to tackle those known risk factors right across the population if we are actually going to prevent maltreatment before it occurs, as opposed to what our statutory systems have been set up and designed to do, which is to respond in order to address once harm or severe risk has emerged, to keep those children safe. This is actually the opposite of that. It's actually trying to make sure that they never get to that point in the first place. And of course, one of the biggest things, therefore, our focus needs to be on is around the needs of parents, because the biggest risk that children face is within their own families. And they need to grow up with safe and supportive, loving parents who are able to provide, you know, discipline and support and safety for children within their families. So then the question that I think about all the time and that I'd be encouraging you all to be thinking about is, what is it that is a critical component of parenting or parenting capacity that can be supported at the whole of population level? And I'll come to some ideas and some evidence-based examples of that in a moment. But when we think of some of those support needs, that particularly those who are in the kind of secondary service system, and by that I mean those who are responding to families where there is a problem that's emerged and they might have been referred either by the statutory child protection system or self-referred by the family for managing problems. And so it could be about the challenging behaviours of children, or it could be about parents who are struggling because of their children's developmental needs, etc. So those are the kind of examples, if you like, of parent support needs that we see in the secondary system. But if we truly are to adopt a public health approach, where the bulk of our investment needs to be is not at the top with the reaction to harm once it's already occurred, nor is it even in dealing with those, significant risk factors once they've emerged, which is kind of the secondary service system level. It's actually at the primary prevention level, supporting all families so that those risks don't emerge in the first place. And the word universal is there because one of the best mechanisms for doing that is building those services and supports into those places where families already go. And I'm really pleased that Jodie mentioned in her introductory remarks the importance of engagement and of trust. Families will often listen better to words of advice and the kind of modelling that is provided by those who they have already developed a relationship and are already engaging with. So that could be the maternal and child health nurse, it could be their GP, it could be the early childhood educator or the primary school teacher. Those are the places that families already go and where they already have levels of trust. Unfortunately, that diagram that we saw before of the...
Excuse me, Daryl, Sheridan, I'm really sorry to interrupt, but we can't see the slides.
Oh.
They aren't moving through, and I know you're speaking to them. I'm just wondering if we could fix that. Thank you. Sorry to interrupt.
No, thank you for letting us know. Maria, are we able to... I'm up to slide 11.
Is that the upside down triangle in hourglass?
Yes.
I can see that one.
Okay. Most people can say they can see the slides. Okay, that's great. I'm just going to charge on, and anyone who can't see the slides, please be reassured that we will provide copies of any of these for you. So this is a copy from an Aracy publication from a number of years ago called Inverting the Pyramid. And what they said was, yes, that's the public health approach, but here's in fact what we have. We've got an inverted system where a lot of the sorry, someone has taken my control away. I'm just going to go back and come up to slide 11, where a lot of our investment is in the tertiary system, or at least in the secondary system. And so we actually have to think about the government investment, but I would also ask the investment that individual non-government agencies make, where they locate the access points for their services, where they locate their expertise. And I'll talk a little bit more about that in a moment. So that's the kind of high level overview. I'm going to dig now a little bit deeper into the rationale for a population level approach to child maltreatment prevention. So if we're going to have that ultimate goal of reducing the prevalence of child maltreatment, we need to be able to increase the kind of normalisation or lower the stigma for seeking help. So, for example, not everybody, well, in fact, nobody really is born with this innate perfect parenting skills. So how do we find out about how we deal with challenges in parenting? How do we reach out for support? And at the moment, it's often very difficult to do that. And access to those kind of supports is often funneled or filtered through either the secondary system or, even worse, through the statutory system. So the rationale, I'm going to talk a little bit about blended prevention in a moment. But what we also know is that from an evidence-based perspective, that in fact there are multiple positive outcomes in terms of child development, in terms of parent kind of capacity and confidence in their skills, and a whole range of different developmental outcomes, both at the child level and at the family and at the community level, can be achieved through running these kind of primary prevention activities. And we know that things like positive parenting programs that are based on, social learning theory and cognitive behavioural principles have actually start to show now evidence that they can produce population-wide outcomes if they are in fact delivered at scale, proportionate to the kind of need that is there. I'm going to skip over these slides because I'm sure that you've seen them all before, but they really just point out the problem that we have in Australia in terms of our current child protection policies, and this is not a criticism of ACT. All of the state and territory child protection departments have this kind of orientation of being very proceduralised and forensically driven due to the massive increases that they've had in their workload and demand. So focusing on risk assessments, and while there are, of course, some emerging trends towards differential approaches and recognition of the need to focus more on prevention and early intervention, the very structure of those organisations is about identifying and managing risk. This slide here, please don't worry about the data, but the point being is that if we take a look back over the past 25 years, you can see that things are not turning around, that while we had, about 3% of children, rate 3 per 1,000 children living in out-of-home care back in 1989, that's over 8 currently. So, massive increase, almost threefold increase during that period. So are we getting the investment right? Are we actually being able to focus on prevention? These kind of data from AIHW would suggest that the answer is no. So the rationale really is there that if we keep on doing more of what we have been doing, that we're not actually going to turn the tide, because we are at the moment still looking at a system that is focused largely at the high-end risk of that continuum that Jodie was speaking about. So how do we get it to all families who have a range of different needs? So people who might have heard of the public health paradigm will have be familiar with Marmot's work in the UK, looking at the social determinants of health inequalities. And his work and the work of others in this space really shows that the actions must be proportionate to the degree of disadvantage, if you like. So coming from this sort of physical health paradigm of needing to address the kind of social determinants of ill health, that we need to be able to ramp up and ramp down the intensity of support in order to be able to deal with those issues. So what we need is policies in order to be able to, whoops, sorry, that just slipped over twice. Let me go, here we go. To make those kind of needs be able to be addressed in a proportionate way. I'm going to skip over this slide because I'm sure Jodie will be able to talk more about what's happening in the ACT in terms of child-safe organisational principles. But we know that even within youth-serving organisations, that risk is not the same and that there are different risks. And so how do we focus on being able to identify and target our prevention strategies to the different risks within different organisational settings, as well as the broader population? Because, of course, a lot of our research has focused on youth-serving organisations, particularly in light of the Royal Commission into Institutional Responses to Child Sexual Abuse, and has not paid similar attention to what's going on in families. So we have a lot of focus on alternate families, such as out-of-home care, but with less focus on what's going on within families and within parenting practices. So I want to talk a little bit about what are some of the obstacles that, in fact, we have to try and overcome if we're going to have public health interventions being directed towards families in order to provide safe and supportive environments. Well, one of the things that some colleagues and I have explored in a recent book chapter is this idea of families being seen as private and sacred. And therefore, there's a reluctance from agencies, from politicians and from the community more broadly in telling parents what they should do. And if you just think about, you go to the supermarket and you see, a child misbehaving or a parent struggling to kind of manage a particular dynamic, how comfortable do you feel in speaking up or supporting or intervening in any way? That's something that we all, I think, find challenging. So how do parents themselves, if they actually recognise that they might want to learn some new skills or reach out and be supported by other parents or by a professional? It's actually very difficult because you end up getting labelled as being a poor parent. And so some of the ways in which we can try and address some of those obstacles could help with things like, for example, the ways that families access services and supports that reduce the stresses in their lives, such as poverty, addiction, and ill health. We also want some of those whole of population strategies to support the early identification of families at risk or in need of additional support. And as I said before, the engagement of those universal service systems that have already been working with families, building trust, and therefore families are more likely to continue engaging with. Now, as I said before, these slides I'm not going to go in depth over. This is really just to show that I've done some work looking at data from the Growing Up in Australia study, which is a longitudinal study of Australian children funded by the Australian government, and data is collected and managed through the Australian Institute of Family Studies, where I previously worked, and colleagues and I had done some analysis looking at some of the different elements of that study that show the kind of profile, if you like, of family environments. And you can see on the screen there, looking at families where there's warm parenting versus angry or hostile parenting, where parent-child interactions are focused around shared activities, and where there's low interparental conflict in the relationship. And so because we had that data longitudinally, so the same children in the same families being tracked over multiple years, we're able to look at those families where in fact there is change. So we wanted to first of all group the families in terms of those where that were seen as, from a family systems therapy perspective, as disengaged, which is obviously negative, enmeshed, the other end of the extreme, also negative, versus those in the middle who are cohesive, where there's warmth, where there's positive parent-child interactions, and only moderate levels of conflict, because of course we know that parents will, typically have some levels of conflict, but it's how they manage that conflict that's important. So focusing on those middle group of families that are seen as cohesive, and sorry, that's just the definition there in terms of how we did it based on the data, whether they changed and whether in fact it had a difference for children's wellbeing, because of course we had a wealth of data looking at health measures such as BMI, body mass index, and injury, so very concrete measures of health, rigorous methods of assessing social and emotional wellbeing, and also their actual educational outcomes in terms of NAPLAN. The data that we show is that yes, family environment do change over time. And you can see there, if you go up from the bottom, the biggest group was no change, so stability, if you like, in family environments. But for those who became cohesive, so either they were more enmeshed or more disengaged and moved to that positive grouping of becoming more cohesive, was about 15 to 20% of children at the various waves. So as they're getting older, moving to more positive family environments. And we were interested to see, well, does that actually make a difference? And yes, it does. So we can see increases here in the pro-social scores and decreases in the difficulty score for that group that became more cohesive. So there's evidence that families change, that children can grow up in environments that improve, and when they do, that things actually get better for them. So concrete evidence that lead us to draw these kind of very, I know they're simplistic conclusions, but they're ones that we often don't come back to, that we actually need to be able to provide supports to all parents about warmth, about avoiding hostility, about engaging in children's activities, reducing conflict with partners. And so then for many of you who are involved either with direct service delivery or with policies that support those, it's about believing genuinely that problematic family environments can be identified at the whole of population level. So remember, this is not a study of problematic families. This is a representative sample of all children and families across Australia. And what we see is that those different types of family environments can be found at the population level, and that when family environments change, children's wellbeing improves. So what is it that leads to those kind of improvements? So the three things that we kind of pointed out in the report was that it's kind of parenting supports and programs that address problematic parenting practices that have been shown to lead to increases in parenting capability and reducing things like parental conflict and increasing things like warmth. We also know that we can have public information campaigns that educate parents and the broader community about the important role of parenting. And there's been some great work about the importance of framing those messages in positive ways and using metaphors like, you know, navigating rough waters as being an important way of being able to support families. But then being able to ramp up the intensity of services and have things like home visiting services and coaching, etc., to deal with families where a greater level of need is apparent. You can see this is not an exhaustive list, but there's a grab bag of different programs that have been shown in thorough kind of research to improve either capacity of parents or directly to reduce problematic behaviours in children and increase kind of pro-social behaviours and social and emotional well-being outcomes for children. So while we know that these things work, are they all working on kind of the same premise, and are they all located within the same environments? Well, the answer is no. Some of those programs are effective because they're actually reducing risks at a really intense level. So they're working with families who have already come to the attention of child protection authorities, or in fact who already have abused their children, and they're really successful at reducing those risks. Others are not dealing with high-risk environments, but have actually been aimed at improving the knowledge and skills of confidence of all parents. And you can see some examples there. What were we thinking? Some of the levels of Triple P, remembering that it's a multi-level program, are also at whole of population level. And you can see this diagram with a continuum, and Jodie mentioned that in her introductory remarks, that public health interventions exist along a continuum of intensity, if you like. And so when we're thinking about evidence-based programs and we're thinking about implementing things at a policy perspective or at an individual kind of agency perspective, we also need to be thinking about what type of evidence-based programs, what type of support are we proposing to deliver. This is my last section, and Jodie, if I'm going all right for time, I'll just spend a couple of minutes talking about some of these challenges to moving beyond the rhetoric, because I think we do often hear the rhetoric of a public health approach to child safety and well-being, that it needs to be everybody's responsibility. We need to help all parents and communities to promote safety. But how, in fact, do we do that? And how do we make a progressive or proportionate universalist approach? Because we know that some families might be struggling and need extra support. So how do we try and invert that pyramid, deal with the whole of population where we need to be investing our resources, but have that capacity to be able to ramp up? And I think one of the problems that we often have is a finger-pointing exercise where we see it as the other person or the other system's problem. So why aren't they doing more? So, for example, why aren't maternal and child health service providers doing more to equip families in those early years, in the perinatal period? Why isn't the early childhood education and care sector doing more, et cetera, et cetera? So we see it as their problem of needing to fix up those kind of parenting problems or the adult problems that might be getting in the way of positive parenting, such as struggling with family violence or struggling with drug and alcohol misuse, which we know are the risk factors driving engagement with the statutory child protection services. But the challenge, and I've said this to a number of audiences in recent years, is I try and flip this around and I go, well, if the challenge is actually to try and get all families to increase their capacity to provide safe and supportive environments, how do I think about the way in which I work? So if I have those kind of skills at dealing with those kind of risks and being able to turn things around, is the way that I work, in fact, part of that problem? And am I perpetuating the kind of status quo? Because if I genuinely believe that universal service delivery platforms are the prime mechanisms for supporting families because they're non-stigmatizing. You know, they're reaching all families where they're already engaging. They have the capacity to kind of, you know, build on the trusted relationships, but can also ramp up the intensity of support. Then the question is, how am I, you know, how is my agency, my program and my service skill being used to support and engage with those other sectors? Are we bringing in, you know, cross-transfer, if you like, of those sectoral skills? So, you know, just a really concrete example. So if I'm a, you know, psychologist and do a lot of great work with children with challenging behaviours, and yet all of my work is one-on-one therapy with parents who are struggling, and who've come to a family or relationship service or to me as a private practice psychologist, is that part of the problem? Or in fact, would adopting a public health approach mean that I would do more of my work with mentoring and supporting early childhood educators or school staff to equip them with the knowledge and skills to be able to better manage and support behaviours, and then in turn model that and work in a kind of a coaching role with the families who they are already seeing, but then perhaps be available to deal with the harder cases and provide that more intense support in conjunction with what's being done by those universal service delivery agencies, who really have that opportunity for delivering interventions by stealth, that kind of unintentional service delivery. So those occasional conversations that might happen at the you know, pick up and drop off when a teacher has a conversation with a parent, or in the waiting room at a GP clinic, or in line for the maternal and child health service routine checks or immunisations. Those kind of incidental interactions might actually be really important in terms of building those capacities. So, Jodie, I think I'm probably out of time. So happy to hand back to you as we now start thinking about what are some of the next steps in overcoming some of these challenges, and what are the implications for policy and for service delivery.
Thanks, Daryl. And, you know, I think you've given us such a broad range of information, and really useful stuff that I think, you know, hits the mark both in terms of the policy side of things, but also some of those really practical considerations. And thank you also for, to, I think it was Marianne and Carly, who, while you were speaking, Daryl, were actually providing a number of comments about, you know, different, I guess, you know, front-end universal service options, but also spoke to, and rightly so, you know, the limitations, I guess, that exist within those, particularly at a resourcing level. And, you know, as I commented, that kind of gets to the heart really of what we're speaking about here, is that, you know, we've got to find where's that right balance of investment. How do we make sure we've got the, you know, the right resourcing at that universal end to make sure we've got really accessible services for the greater population, everyone in the community. But equally, you know, not losing sight of the fact that we're still going to need those nuanced and higher order responses for those who perhaps have greater challenges. Keep coming with those comments as we move forward, and you know, we can come back to them as we need to, but particularly if there's any questions that some of this is raising as we go along. You know, speaking to, I guess, and thinking about those things that have been put forward already, there are already some forums, I guess, and certainly some that I'm involved in that seek to, I guess, develop, to strengthen, to embed more widespread implementation of public health approaches. And, you know, I'm fortunate, I think, in this role that I get to be involved in ones not just locally, but also at the national level. Locally, one of the great initiatives that was kick-started with our last government, and that I trust it will be continued with our new one, is the Best Start for Canberra's Children, and I'm on the first 1,000 days reference group there. But again, something that's very much focused on how do we get in as early as possible and identify where there might be a need, but also, and more importantly, making sure, I guess, the access to services is there regardless of whether there's an additional need or not. At a national level, promoting children and young people's safety and wellbeing is also one of 6 key priority areas for the Australia and New Zealand Children's Commissioners and Guardians. of which I'm a member. And I'm also part of, and there was a bit of a conversation in the chat about playgroups. I'm also part of a national advisory group for Playgroups Australia. So there, a lot of those, the conversations are already there, and it's really about us looking at what else and how do we add to those, and how do we make sure that the conversations are backed up with appropriate service investment as well. Here in the ACT, for those who are ACT, we are moving forward in hopefully within this current financial reporting period to implement child safe standards off the back of the work of the Royal Commission. And hopefully, all of you would be familiar with the child safe principles, which provide a nationally consistent approach to, I guess, creating organisational cultures that foster child safety and well-being. And a key goal, I guess, underpinning those child safe standards and child safe principles really does equally get to the heart of public health approaches about how do you, look at all of the vast array of different environments and groups and organisations and locations that children and young people engage within, and seek to create a platform or a culture that fosters that well-being. The principles themselves, I guess, provide a bit of a framework for establishing the leadership, the cultural, the administrative elements of child safe practice. But particularly, they look at how do you embed child safety and wellbeing in organisational leadership, in their governance, in their culture. How do we make sure that staff and volunteers are equipped with the knowledge, the skills, the awareness they need to have to keep children and young people safe, both through their upfront training when they might join, but also in an ongoing way. The principles also focus, I guess, on making sure children and young people themselves are informed about their rights, that they are able to participate in decisions affecting them. And I know I speak about this so often, but also making sure that their views are taken seriously, and that in and of itself, and the work that the ACU did in the course of the Royal Commission about safety, I guess, and children's views about safety, really demonstrated that being taken seriously in itself provides a really important protective factor for children and young people. Importantly, the principles provide also and speak to the need for widespread understanding by children, young people, families, the community more broadly, about what is involved in being child safe, in being child friendly. And I think, all of those things as we're moving forward, and as regulation is one thing, but I think what I'm really keen to see is, opening up this conversation about is, while we've got some of those public health approaches already at play, how do we consolidate that? How do we really build on some of those early platforms to strengthen and enhance those public health approaches, particularly at that universal level of support? And I'm really keen to work with those of you who are interested in doing so. We'll talk about some ways to perhaps create that network and keep this conversation going later in our conversation today. But for me, I guess, and it does come back again to the ACU research, I'm really keen to make sure that not only are all of us in those conversations, but that children and young people are too, so that we make sure that whatever we do helps them to not just be safe, but importantly to feel safe. And again, that comes back to some of the messages we heard directly from children and young people in the course of the Royal Commission. Now, I can't keep up with the comments and, focus on thinking ahead for myself at the moment, so we'll come back to that. But I'm keen to probably start opening up the conversation around what should our next steps be. And perhaps, Daryl, I might briefly throw back to you at this point to, I know you've probably been tracking those as I've been speaking, to perhaps start that conversation by responding perhaps to some of the comments there, and then we can hopefully get this a bit more free-flowing as we both grapple with the things that people are throwing up rapidly as we speak. Oh, actually, I should say, while Daryl's speaking too, please keep sending through those comments. I know we keep reiterating that, but I guess that's the way we can hopefully keep, talking, I guess, and speaking through this. So, Daryl, over to you again.
I'm just trying to
type and
there we go. I'm unmuted. Great.
You're right.
And I think that that's a really good example of a fairly accessible strategy or a platform. The challenge, though, is still playgroups are kind of like, you know, schools or early childhood education settings where it is a platform, but it's also how we use it. So what are the skills that we bring in and use in that space? So on one of the slides that I had, I talked about a program called Sing and Grow that's actually run by Playgroups Queensland. And they have just published some evidence regarding the way in which that particular structured music therapy program that can be delivered through a platform like Playgroups can lead to very concrete outcomes. So I would say it's kind of yes and. We need to be thinking about the service delivery platform that we're building our public health approach on, but it's also about the micro skills of what it is that the workers in that space and the structured kind of programs that we put around them are doing. Back to you though, Jodie. One of the questions that came through from James was, is ACT kind of uniquely placed in terms of being able to address some of these issues because, I suppose, of the size and of the structure of government, having those interplay, if you like, between the different directorates within one level of government?
Yeah, look, I'd like to think so. And, you know, the idealist in me says absolutely we should be. You know, we're here, we're a small jurisdiction. You know, we can literally walk, you know, 5 minutes and we're probably in each other's offices half the time. I think we still, you know, I think we've still got some of those silos though, and I think that's part of what we do need to see about, you know, how do we break that down? How do we make sure that everyone knows what others are doing? And, you know, some of the things that I have the opportunity is I see things that go through the Legislative Assembly, and, you know, oftentimes I'm interested that a particular initiative or area of reform that's being proposed is written in a way that doesn't recognise, I guess, the other things that are happening around it in those other systems. And I think that's something, you know, I think if we get better at making sure we're contextualising a particular reform within and around those other things that are occurring, that kind of starts to break down those silos more and more. So, you know, I think in response to James's question, will it be easier? I think it can be, but it does rely on all of us who are part of these conversations, talking, you know, making others aware, linking others in. And that's certainly something I try to do where I see linkages through my work, is to go, hey, I've heard of something happening over here that seems to map quite well to what you're trying to achieve here. How about I make that connection for you? And I think if we all start doing that more and more, it actually will make that easier, given we are such a small jurisdiction. You know, extending and creating those virtual introductions to people is often a really good first step, just to actually get those things going and have people know what else is happening around the place. We all get caught up in our little bubbles sometimes, I think, and assume that others know, when often, you know, they might not. And if we, you know, kind of go merrily along with that assumption, then we're probably not putting it out there as widely as it needs to be.
Yeah. A couple of other comments that have come up. Lauren's made a point which I totally agree with, that she would like to see support more intensively where needed, be ready, available to support parents, which raises the question of how early is it that does that need to be, because she raises the issue that it also needs to be about people preparing for parenting. And recognising that some might need more time and more support to learn parenting skills and to have the kind of tailored help through pre-pregnancy and throughout pregnancy towards parenting. Jodie, do you want to kind of comment on that?
Yeah, look, I thought it was interesting earlier, something I didn't know, and I can't remember who made the comment earlier up in the thread, but the thing that if you've accessed the match services for a one child, that you can't access them for a second child. I was really interested by that. You know, I think when I kind of think about how different, I've got 4 kids, and every single one of those kids has been different in their own way, even as babies. And so I find it really interesting, and I'm probably going to look a bit further into that to make sure I understand it more thoroughly. But, you know, if I think about the different challenges that I had as a new parent for each of my 4 kids, you know, there were different supports that I needed or different advice that I needed for each of them. And that's just, you know, one part of it. But, you know, if we're blocking off one opportunity to get support or to get advice or to get a direction or even just a couple of strategies to stop the child crying. My first was a big crier. You know, anywhere we need to go, you know, we should be able to get it. And I think, you know, it does speak to, I know, the resourcing issues, I guess, that lie up behind that. But I think that's part of what we're really speaking to, Daryl, is, you know, if we know that there are limitations because of resourcing, but where that service is one that it has such value for parents, regardless of how many kids they may or may not have, well, may have, as in 1 versus 5. You know, I think we've got to get to the heart of that, and we've got to go, what are the things that parents find most useful? And if, you know, if match service responses are part of that, well, how do we invest in that? If playgroups are part of that, well, how do we invest in that? You know, what is it, what's going to take to make sure that when a parent or a family puts up their hand and says, I actually need that little bit more, or I just need someone to talk to, that someone is there or that service is there. Yeah.
Now, I'm just trying to see the question.
I'm trying to keep up as well.
Question around collaborative practice. Keen to know, so Miriam asks, keen to know our thoughts. How do we foster a culture of practice of collaboration and shared risk-taking when there is inherent mistrust and possibly even antagonism between parents, child protection, and perhaps other agencies? Can I perhaps begin by answering that, Jodie, by saying that I think it's because of those issues that I was saying about where we locate those services. So the way to kind of get, so particularly about the antagonism, if you like, between parents and the kind of service providers, if you like, when we have to use the sort of coercive powers that we have through child protection interventions and the legislation that sits behind it to get parents to come along and do something, we've kind of we've missed the boat in many respects. What we want to get is that willingness to actually reach out and receive support, or in fact get the support without even realizing it that you're receiving it, which goes back to those examples that I was giving of where are the places that parents are already coming in contact and where you can inject, if you like, those skill sets that you bring. So I would argue that it's about the location, you know, both the physical location, but also the kind of organizational structural level location, if you like, of our service and how that's perceived by other intersecting service providers, but particularly by the client group. And of course, we often identify those client group in terms of their troubles, which is totally the antithesis of a public health approach, where it should be primarily about messaging and supports for all parents, and then within that, the capacity to kind of put our arms around and provide, you know, that kind of additional support where it's needed. Jodie, did you have any thoughts on that issue of, you know, collaborative practice and shared risk-taking in the face of mistrust?
Yeah, look, the question raised a couple of things in my mind, and I think, you know, I'd love to blue sky it and say, you know, hey, if we had everything in place, you know, we wouldn't be even asking the question. But, you know, I think that's probably a bit unrealistic given we're not even close to that yet. But I guess it, you know, to me, it's a number of levels to it. You know, how do we normalise help-seeking behaviours? And part of that actually goes to the heart of the question in itself, in that some parents are too concerned to put their hand up and ask for help because they're concerned that the response might be a statutory intervention one, rather than a here's a support that you might be able to access. You know, I think interestingly, you know, some families, and perhaps because of the transient nature of the ACT, or not for all of us, but for some families aren't even aware of the existence of child and family centres, and yet, you know, there's a great source to be able to go to and potentially get the assistance, you know, to branch out into different areas of need. I think it's also about how we engage with families where they have become the subject of some form of further inquiry or investigation as a result of a child concern report. But, you know, ideally, as you know, if we've got the services there, then it's about introducing them when that first concern report, even if it doesn't meet the threshold for any form of further inquiry. How do we provide some information that says, you know, hey, you might be interested in having a look at this or having a look at that? And then, you know, as we're progressing through, if it does go into, you know, the further inquiry space, still responding, I guess, in a helpful and useful way. And I'm always concerned that some families, because of the stress, I guess, involved when they do come to the attention of care and protection, that the message they get at the end of an appraisal that isn't substantiated is one of, phew, nothing to see here, I must be doing everything right, rather than the message of, look, you know, you're really close, not over that threshold that requires us to take action, but we don't want to be taking action the next time we knock on the door. So here's where you can get the kind of supports that you need. And, you know, I know we have some very good people on the front line who are great at that wayfinding, I guess, for families who don't meet that threshold for intervention. But that sort of needs to become embedded, not just in that care and protection system, but I think across the board, as we're speaking about, you know, in health systems and education systems and, you know, general community settings where, you know, people know where to go to and who to, you know, I guess, point in the direction of where they see someone who's struggling.
Yeah. Thanks. And it's a really interesting question or comment from Jane about one of the challenges in advocating for a population approach is the difficulty in finding evidence of effectiveness, and where there is evidence, the benefit may not actually be within one particular government cycle. I would also add to that, another of the challenges is the benefit is likely often to accrue to a different government department silo. So our siloed nature of, you know, if I'm the education department, I'm funded to produce, you know, kind of NAPLAN score worthy graduates of my school system, whereas I'm not necessarily thinking about, am I preparing the next generation of parents? You know, am I being able to support, you know, reduced notifications to child protection because I've got these family support workers who are in and part of my school and doing this fantastic work. I'm not funded to do that. So I think some of the solutions there have to actually be around going to what is the shared outcome and creating collaboration around, you know, those kind of funding streams in order to be able to deliver on that, so that we can no longer say, well, this is not, you know, this is not part of my work, but rather across, you know, it could be 2 or 3 or 4 government department areas, or in fact agencies who are funded under different areas, to say, well, look, let's come together. I'm funded under, you know, a sort of social service funding stream to do X, but what if I came and I did that within your school environment, because you're not funded to do this, but I've got the skill and I can get the funding to do this particular thing. But if I based it here and did most of my work as coaching and support for teachers or for early childhood educators or for your nurse practitioners or whatever it might be, would that work? So I think at all levels, it's not just the government's fault for having silos. It's also those of us who are working in the kind of service provision area, you know, we need to be thinking, how can we use those natural kind of political cycle constraints that there are and make the best of it? So don't just hand responsibility back and say, governments are short-sighted, they just want to have outcomes in 3 years. We have to say, how do we use that to actually motivate us to think differently about our work, about our collaborations?
Yeah, look, I think that's certainly some really good points, Daryl, and it's you know, I think that's part of why I'm keen to see how we can build this network locally. And I'm seeing already that a number of people are actually putting their hands up and saying, yes, please, I want to be part of this, which is really good. And I think, you know, it is about mobilising at multiple levels, as you've been reflecting on, Daryl. You know, there's, you know, yes, government is part of that, but we all have different roles that we can play in that. And, you know, I reflect recently, I had a conversation with Relationships Australia and was just kind of musing about a couple of different things. And got back to my office, and I think it was only an hour later, I got an email saying, guess what, we're acting on that, we're going to do this. And it was, it's that kind of responsiveness that sometimes can actually happen at the service provider level. And I appreciate, not all service providers necessarily have that. Again, sometimes that comes down to funding. But the working together and the ability to go, hey, if I do this and you do that, and again, Daryl, you were speaking to that, that can bring together a response that actually is more supportive. Now, I'm conscious of time, and we only have about 4 minutes to go, so we're going to have to be winding up. I'm just checking through these last couple of comments that are coming in. Now, do please, we will, and I think already have by the looks of it, put Trish Mackey's, Patricia Mackey, Trish's email address into the feed. If you are interested in being part of this conversation or continuing this conversation, I guess, moving forward, then yeah, please either email Trish or respond in the comments feed, which should remain available to you even after we finish the webinar. I'm seeing them all pop up. Equally, and what was I going to think? I think actually what we will do also, because I'm aware we may have missed some of these, the comments as they've been coming thick and fast. So my apologies if we have missed particular comments there, but we'll review those after the webinar so that if there are, and probably capture them, to be honest, in a way that perhaps informs those next step conversations as we move forward. Because I think a lot of that commentary is pointed to different initiatives, it's pointed to different ideas about how we can break down some of the challenges that are there. So I think
examples of that, I think, Jodie, are things like the first 1,000 days conversation. Now, of course, that's at one end of the developmental spectrum, and we need to be thinking about how that continues on beyond the first 1,000 days. But it's a great example of how we have this kind of cross, kind of portfolio approach, if you like, to thinking about what positive outcomes could be at the whole population level, not just focused on the high risk issues.
Yeah, look, absolutely agreed. And I did want to pick up, there was a great comment there that I think is really central as well, and it's about the need to make sure that we're actually evaluating initiatives as we're particularly where we're seeing or anecdotally feeling like they're leading to improved outcomes. Because here I'm relatively new to the ACT, but people at different times since I've been in the role have reflected on initiatives and things that used to be in place some time ago that were really effective that got defunded. And against defunding is actually being able to formally evaluate and demonstrate with that evidence that an initiative truly is creating the outcomes that you're seeking to achieve. With only 2 minutes to go, Daryl, did you have any final comments or comment? It's dropped down to 1 minute, so I'm going to have to really cut you tight that you wanted to throw in.
Only to say thank you so much for inviting us to be part of this conversation, and how heartened I am to see, first of all, the number of people from the ACT and beyond who've joined the conversation. And I can see the comments scrolling through now saying, I want to be part, I want to collaborate, count me in. So I think that level, that groundswell of support from people of goodwill who are prepared to kind of go beyond the existing kind of boundaries, if you like, of our thinking of, responding to harm, and actually think from a primary prevention lens of what promotion of wellbeing looks like for all children and families is fantastic. So just really excited that the Institute of Child Protection Studies was able to be part of this webinar with you, Jodie.
Oh, look, and thank you, Daryl. Really appreciated you taking time. I know you guys are very busy, and there's a number of you who've been part of pulling this together. So I know the resourcing that comes with that, and really appreciate you taking the time. And I guess on behalf of myself, but equally I trust on behalf of everyone else who's joined us today, which I just saw was at 118 people at its peak by the sound of it. I'd just like to thank you on behalf of all of us, but also to thank everybody for being part of today's discussion. Really appreciate you taking the time, and we will continue it. Trish is frantically beside me trying to take down all the names, but the feed will remain, so we can we'll make sure that we capture everybody. I'll close it down now, but feel free to use the chat thread that should still exist behind it if you do keep wanting to comment, or email Trish directly. And as I said, her email address was there in the feed. So thank you, everyone. Overwhelming response, and you know, far more than we'd expected. And yeah, just really affirming for how important other people equally, how much importance, sorry, other people equally place on this. So thanks again, everyone.